Assalamu alaikum rahmatullahi wa barakatuh. In my previous audio about osteoarthritis, we discussed the clinical features and how to diagnose osteoarthritis and how to manage today and how to take the history. Today we will discuss how to examine, how to present to the patient and how to present to the examiner, right? So in the examination, the first one thing remember that examination of all joint patient is same as I have described in detail in rheumatoid arthritis. Okay, if you get any joint disease, any joint scenario outside, the sequence of examination steps will is same. Okay, like what to inspect on hands, what to palpate, and prayer sign, reverse prayer sign, crossed in front of chest, place hand behind the head, place hand behind the back. So this all sequence is same, and but because these joint diseases overlap, but the thing is you have to look for the specific features, the distinct characteristics of any relevant joint disease, which can help you, which can lead you to the to making of your diagnosis of any respective disease. Like in osteoarthritis, now you will see the patients the joint in pattern of joint involvement is PIP and GIP, while in rheumatoid arthritis there is only PIP, right? And you will see most commonly patients can have metacarpophalangeal joint involvement, it will be single, while in rheumatoid arthritis they can be multiple, right? So in this way you will examination steps will be same, but in your mind you will keep on ruling out other diagnosis, other differentials by whatever signs, whatever points you will get on examination, right? So again you will do your inspection and you will see that if metacarpophalangeal joint is involved, there will be scarring. Okay, and you will look again for deformities, and if it is a knee joint, so in the knee joint examination, first of all again you will do the inspection, you will look for any swelling, any redness, any rash, any scar mark, right? Then what you will do, you will feel the temperature with the dorsum of your fingers, dorsum of your hand, right? Feel the temperature difference and compare it with the rest of your leg, with the rest of the patient leg or with you, and then check the tenderness of the knee joint in the joint line, right? And after this you have to check for crepitus by passive movement of the knee joint and look for effusion, and by doing the bulge test. And how to do the bulge test, place your like left hand above the knee and exert pressure down, like milk the suprapatellar bursa down towards knee and looking for a bulge in the medial patellar fossa. If it is there, it means an patient has effusion. Okay, so like this you will do your examination in of the knee joint. And in the hands also you can find Heberden nodes and Bouchard node. Heberden nodes are present at the DIP joint, while Bouchard nodes are present at the PIP joint. These are painful and these are basically osteophytic extensions of the joint, right? While tophi, which were present in the gout, these are non-tender, right? And also rheumatoid nodules in the rheumatoid arthritis, these are also non-tender. So you will keep on ruling out like this. Okay, like any swelling if you found, then think that whether this is Heberden node, Bouchard node, this is tophi, or this is rheumatoid nodule. Like this you will keep on ruling out the other differential, and in the end you can check the gait of the patient, and the patient will have waddling gait. And Trendelenburg sign may be positive. And what is Trendelenburg sign? What is this? If patient is standing on one leg, the pelvis drops on the non-weight bearing leg, showing weakness of the head stabilizer on the weight bearing side, right? And patient can have antalgic gait or limp, and what happens in that, the phase of gait is shortened to alleviate the pain on the weight bearing side. Okay. And so you will look for, in the end you can ask patient, can you walk for me, and you will know. So now how to present to the examiner? You will say that on examination of this gentleman, I found that like if in the hands, if you find, you can say that patient is having asymmetrical bony swelling with involvement of distal interpharyngeal and proximal interpharyngeal joints. It's scaling of first metacarpophalangeal joint having Burden nodes and Bouchard node. No evidence of rash. So on the basis of this my diagnosis is patient is having osteoarthritis. And if it is knee, then you will say that on examination of this gentleman, I found that there is varus deformity of the knee along with fusion and crepitus, and the gait is antalgic with Trendelenburg sign is positive. So on the basis of this my diagnosis is patient is having osteoarthritis. And now how to present to the patient? Now you have greeted the patient, you have taken the history, you have done your examination, and then in the end you will ask about, okay, please tell me what are your concern. So you will say that, well, I appreciate your concern from the history and from the examination which I did for you. It seems that you have some destruction of your joint, and it is a condition which is called osteoarthritis. Is that okay? Okay. There are many causes for it, but in your case it seems to be associated with your if the patient is having history of injury, then associate it with that. If patient is having family history, associate with that. So whatever you found in your patient, you will associate it with that. Okay. However, still to confirm my diagnosis, I need to examine you in detail, do some of test. Is that okay? Okay. And I will not admit you, and I will book early appointment for you. I will manage you with a group of specialists like my consultant, joint specialist, physiotherapist and occupational health therapist, and right now we will give you some painkillers. Is that okay? Okay. And do you have any history of heartburn? Okay. So any other concern you are having? So like this you will end your consultation of osteoarthritis.
Please like, share and subscribe my YouTube channel for more videos. Thank you.